This is a special report from WDHN News.
I'm Paige Weeks, bringing you a WDHN News special report. We take you live to Montgomery right now, where Governor Ivey is about to hold a joint press conference to provide a COVID-19 update. We can see her walking to the stand now. We go to the governor.
Well, good afternoon, everyone. It's certainly been quite a week, and as I've already said publicly, I'm grateful that the Alabama legislature was able to finish its business on Monday, adopt and approve both budgets, and agree on a pathway forward to make certain that the Federal CARES Act monies will get to the people of Alabama who have been economically impacted and hurt by this disease, and obviously those are the folks that need and deserve help. In the next week, my administration will be announcing some different ways that members of the legislature, as well as the people of Alabama, can have direct impact into some of the different options that might be available. Today, however, is the next step in what has seemed like a long and difficult process of reopening our economy, while at the same time remaining true to the belief, the fact that, y'all, this is a serious, deadly disease. As Dr. Harris said yesterday, our numbers are not as good as we would hope. And in some cities and counties, Montgomery being one of them, there are some very legitimate concerns with a large number of people being hospitalized, filling our ICU beds. And this is not only a cause for concern, but it's something we're certainly going to keep a strong eye on in the following days and weeks. Now, in all fairness, all of the patients in ICU are not COVID-19. So if you've had a stroke or a heart attack or been hurt in a car wreck, certainly you need to be in an ICU bed. Regretfully, many of our nursing homes are still a hotbed of activity for COVID-19. And that's why neither Dr. Harris nor I can, with a clear conscience, allow things to return to normal as it relates to reopening our nursing homes and hospitals to visitation beyond compassionate care situations. There's also more troubling news on the economic front. Tomorrow, Secretary of Labor Fitzgerald Washington will announce Alabama's unemployment rate for April. It seems like a lifetime ago when our unemployment rate was at an all-time record low of 2.7 here in the state. But when more than 500,000 people filed for unemployment during the past 2 months, and more than $1 billion has been paid out in unemployment compensation, folks, that's a lot of hurt and a lot of pain out there. On the positive side of things, we have some good news. This week, the state of Alabama, and in particular, the Department of Public Health, inked a deal with two of the biggest technology names in the world, Apple and Google, to use their contact tracing app to track those who may have been exposed to COVID-19 using Bluetooth signals. Alabama, North Carolina, North Dakota, and South Carolina are the three first states in the United States that have joined some 22 countries around the globe to join hands with these two global giants in hopes of helping our people learn how to, when and where they may have gotten contacted or exposed to this virus. And hopefully this will become an important tool in the toolkit to slow the spread of coronavirus by using what almost every Alabamian has in their pocket, a cell phone. Entering the stay-at-home order in April and the current safer-at-home order, which we're now in, has always been an attempt to slow down the spread. We knew we would never be able to eliminate it, but we wanted to slow it down. The drastic measures of the last 2.5 months have been out of a need to slow the spread and help prevent a surge of our hospital ICU beds. Obviously, in the state, some are experiencing higher rates than others, but however, statewide, we have not exceeded capacity, and everyone who needed a ventilator has been able to receive one. Currently, there are medical experts all over the world working on finding a vaccine. And for the record, I want to let you know I will not be at all surprised if a vaccine was created right here in Sweet Home, Alabama. However, we cannot sustain a delayed way of life as we search for a vaccine. There are many viruses that we live with and have worked necessary precautions into our daily lives. And similarly, it's now time that we move forward and further open our state and live with a new normal of incorporating COVID-19 precautions into our routine. Now, as it relates to the changes in the current order, let me get right to the point. Just as we've had to learn to live with the flu and other viruses for which there is no known cure, it's not realistic to think we're going to be able to keep everyone totally isolated from each other forever. To that end, effective Friday, May 22nd at 5 p.m. and running through July 3, we're going to expand the number of businesses that will be allowed to reopen while maintaining a 6-foot distance, and by adding an extra layer or two of prevention and precaution on those who own these businesses as well as those who frequent these businesses. This will have the net effect of expanding our recent Safer at Home order with 3 caveats. The first is, if things don't get worse, and I certainly hope and pray they don't, then we're going to continue putting personal responsibility on each and every individual citizen. Personal responsibility also extends to the store owner, the summer camp operator, the hairstylist, the youth sports coach, and pastors. It takes all of us, y'all, being vigilant and adhering to these social distancing guidelines in order to stop the spread of this disease. And I'll just tell you, I sure miss being with my friends, going to church and having breakfast at Dirk's. But I've learned how to hold Zoom meetings, speak virtually to a Rotary Club, and I'm going to do my first drive-by birthday party later this afternoon. We can all do our part. However, if we start going in the wrong direction, then we reserve the right to come back in and to begin to reverse course. Secondly, although we're expanding the list of places that can reopen, we're also adding important additional requirements on social distancing and sanitation that we all must adhere to. As Dr. Harris and I keep saying, this disease is deadly, and it is not something that we can take lightly. And finally, for those who just aren't comfortable going out to your favorite establishment and acting though everything is back to normal, we get that. Clearly we get that. And you're right, things aren't back to normal. And in fact, we probably don't yet know when the new normal is going to look like. So let me invite Dr. Harris to come up and give his report, and then we'll be happy to take your questions.
Thank you, Governor. Hey, good afternoon, everybody. Thank you very much. Thank you, Governor Ivey. Appreciate it very much, the chance to be here. As the Governor said, we certainly would like to see some improvement. We have about 13,000 confirmed cases so far as of today. Our recent numbers, daily numbers for the past several days are around 355, 366, 297, 342, 321. So we have a fairly level number of cases over that time, although a little higher than when we were here last. That said, our percent positive of cases, the percentage of cases that are positive when we test has declined for the past 3 weeks. I don't think that means that we're out of the woods by any means. I think that means we continue to have disease transmission here in our state, and there's a lot of care that we need to take, and a lot of practices that we need to continue to work on and to emphasize with people. We certainly have hot spots in parts of our state. Right here in Montgomery is one for certain. We've certainly seen them in other parts as well. And I think what we anticipate going forward over the next few months is that we will have these rotating hot spots. We may have lower levels of transmission going on in different places, but we'll continue to see places where we get a surge from time to time, and that's similar to what we're experiencing right now. As of today, we have over 600 patients hospitalized around the state, but we're fortunate that ventilators are okay. Ventilator capacity is good, even here in Montgomery. As the governor mentioned, we have a shortage of ICU beds here, although statewide our capacity remains good. As we see, all 50 states now are moving towards at least some form of reopening. We want to make sure, as we do that in Alabama, that we continue to issue health orders that are responsible and that continue to keep people safe and continue to emphasize all the things that we need people to remember. This still is a safer at home order, and we want to emphasize that. We believe people are safer at home to the extent that's feasible. We believe people who have certain medical conditions or are medically fragile really are safer at home, and we want to encourage them to remember that in their behavior. So let me highlight for you what the changes are in the current order. We have more things that are opening, but we've issued more guidance on safety and more guidance on behavior and more guidance on the practices that we would like to see businesses and people to put into place. This health order will run through July 3rd, as the governor said. We will continue to have non-work gatherings ruled the same. That is, there's no number limit on non-work gatherings, but we would prohibit any type of gathering within 6 feet of people from different households. That certainly continues to allow things like churches to meet and many other type of social functions, but we want people who are not family members or not from the same household to continue to observe that 6-foot distance. Child care facilities have remained open, but we are not adding an additional number limit or maximum on those child care facilities, as we previously had required less than 12. There are, of course, DHR requirements about staffing ratios, which this doesn't affect. But child care facilities can continue to remain open without that limit, but we have added social distancing requirements for adults. That's certainly not always feasible for kids, of course, and some sanitation and hygiene requirements as well as face coverings for staff working in those facilities. We have addressed all the entertainment venues that were previously closed under the last couple of iterations of the order, things like performing art venues and museums, tourist attractions, and so on. We have specific guidance for a lot of those. We had received guidance from industry and also a great number of guidelines from CDC related to things like water parks, for example, bowling alleys and things like that we have made reference to in the health order. Those venues are going to be allowed to operate at 50% capacity, and we have, again, certain social distancing requirements, sanitation and hygiene rules, and the use of face coverings whenever that's appropriate. This health order will remove the closure of schools. Obviously, K through 12 schools is what Dr. Mackey and his team have been working so diligently on, and they continue to work on that plan and issue guidance to all the school boards around the state, who ultimately will make those decisions about when it is safe to reopen. Colleges and universities obviously are working on their own plans related to that. The main effect of the health order has to do with certain technical and specialty schools. So we have a lot of schools like truck driving schools and aviation schools and culinary schools and so on that are training programs that are allowed to reopen subject to certain restrictions, like I had mentioned before. Finally, youth sports and other athletic events are going to be allowed on a gradual basis, starting when this health order takes effect tomorrow evening. There will be practices, conditioning, drills, that sort of thing for youth sports, and then we will ask them not to engage in direct competition, which would draw crowds of people until after June the 14th. So effective June the 15th, that youth sports competition and other athletic competitions can resume at that time. And then finally, I'll say, like with previous health orders, these are statewide health orders, but we certainly recognize the ability of Jefferson County and Mobile County health officers to issue those orders that they see appropriate for those communities as well. So that's the highlights of those health orders, and I'll in a minute be glad to answer questions about that. I just want to say that reopening Alabama really only works if we all cooperate. We are moving to reopen these things, but it has to be done safely. This is still a safer at home order. We really need people when they're going out to businesses and going out in crowds to remember face coverings. I want to emphasize that. We really need people to avoid unnecessary trips if they don't have to make them. Please use your discretion and use your common sense. Please stay home if you're sick. All of these things we've been talking about for weeks and weeks now about hand washing and so on are so vitally important if we're going to make sure we're protecting the most vulnerable people we have. These are really simple changes in our behavior, but they save people's lives, and they're really important. And really, now more than ever, we need people to take social distancing seriously. When people were sheltered in place, honestly, social distancing wasn't quite as important. But as the economy reopens, it's even more important than ever. So we don't yet have a cure or a treatment for this disease. But the best thing that we have is for each of us to watch our own behavior and make sure we're protecting ourselves and others. So thank you very much.
Thank you so much, Dr. Harris.
To recap, Ivey's new amended Safer at Home order will go into effect tomorrow, May 22nd at 5 o'clock in the evening. The new order will open entertainment venues with social distancing guidelines. Athletic activities will be allowed to practice May 23rd, and athletic competitions will be allowed on June 15th. Education facilities can open June 1st. Child care and summer camps will also be allowed to open with social distancing on Friday at 5 in the afternoon. Now again, Governor Ivey and her administration has increased social distancing guidelines in order to allow these businesses to reopen and these activities to resume. This new order will end on July 3rd at 5 o'clock. To learn more about this amended order, visit our website, dothanfirst.com. And for what this will mean locally, how it will affect the Wiregrass, be sure to tune in for full reports on our WDHN newscast tonight at 5, 6, and 10 o'clock. I'm Paige Weeks. We now return you to regular programming.
You've been watching a WDHN News special report. We now return to our regularly scheduled programming.